My name is David Shaye. I'm a facial plastic and reconstructive surgeon and a ENT surgeon, ear, nose, and throat. So I operate on the head and neck right here, mostly reconstruction. I work at Shaye Hospital for 4 months every year since 2015. And then I work in Boston at Harvard University the other time every year. And I've been coming to Shaye for 11 years working here. Okay. So I studied in the US, I'm American. I studied in the United States at Minnesota, New York, and California, different parts of my career. And now I'm teaching surgery, reconstructive surgery in Boston at Harvard University. So in Rwanda, I see patients in the clinic, and then I operate on patients with my colleagues, my Rwandan surgeon colleagues who are my friends. We see patients together, we operate together. I think over 11 years, we've probably operated on somewhere between 1,000 patients as a group, and we've seen probably several thousand, maybe 3,000-4,000 patients in clinic. Yeah, I think so, yes. That's an estimate. A variety of things. We do cancer, tumors of the face. Sometimes the tumors have to be cut out. Then we think about how to reconstruct. We also address trauma. People in road traffic accidents, they lose parts of their face. We think about how to reconstruct. And also children born with a congenital deformity, either a cleft lip, you call it ibi-babi, or a problem with their nose, maybe they're born without a part of their face, we can try to help reconstruct. So the nasal reconstruction, the reconstruction of the mazul, is an area where I really like to focus. People lose their nose from cancer, congenital problems, or trauma, a bite injury or a road traffic accident. When you have no nose, people they're ashamed. They can't sometimes go to the market or interact in society. So we have ways of reconstructing the nose, and it's really very interesting. So thank you for asking. The nose you make in layers. It's an unusual thing. It sticks out from the face. If we all have our noses, nobody looks at another nose and says, that's a beautiful nose. But when you're missing a nose, it's very, very hard. So when we reconstruct, we want to make a nose that no one notices anymore. We think it's normal. And we use different parts of the body. That includes the rib cartilage. It includes skin from other parts of the body. And it includes a piece of the forehead, which we turn down. Using these techniques over a few surgeries, we can achieve a nice looking nose that other people don't know is different. In Rwanda, I came my first time, my wife, who comes with me, and my 3 children. My wife had been here before, and she loved Rwanda. She said, we must go. And we both fell in love with the country and the partners that we could work with, because we can do so much together. Alone, I can't do too much, but I have so many great colleagues that I work with that we find that we can achieve so much in this country. The body will not reject its own body. So when we take from parts of the patient, it's okay. Sometimes you get an infection, but most of the time it can live. But if I took from someone else and put here, that doesn't work. The body will usually reject that, so we don't do that. We only take from your own body. I've operated on maybe about 2,000 patients worldwide for big surgeries. That includes Zimbabwe, Nigeria, Nepal, Guatemala, and Rwanda, of course.
In
Rwanda, the most. Over maybe 1,000 to 1,200 patients in Rwanda that I've operated on. I think if you just come, it's maybe scary to come to the doctor, but there are so many patients that there's a lot of ability to help. They can change their life, improve for the better. So if you're worried about something, come, get it checked out. The earlier, the better. We can sometimes address something earlier, and sometimes we cannot. And we'll tell you very honestly, what we can do. And then you can make your own decision. All the surgeries, the reconstructions are covered by mutual, which is fantastic that Rwanda has that ability of coverage. Yes, it is certainly progressing. Oh, I've been for 11 years. I've seen more operating rooms, more doctors, more surgeons. The surgeons are now not only Kigali, but outside Kigali. Now outside Kigali, there are more operating rooms. Musanze, we just saw a new dedication. Gisenyi, I'm going next week, and we're seeing the building of the operating rooms. And then there's more anesthesiologists. And so everything is expanding. For me, I can give my small thought is just to continue the focus on education, to build up the subspecialties, meaning you have such a good base of different surgical and medical specialties, and then we go to the next step, the subspecialties. And I see in Rwanda's future, since everything works so well and you're so motivated as a country, that people from other countries will come here to study. That's what I think will happen in 10 years.